Miss Rios. I'm Dr. Schroeder.
Hi, nice to meet you.
What brings you in to see me today?
Well, lately I've been feeling very tired and I've been getting dizzy, and also I've been having chest pain, and that was very concerning for me because I've never had that before, and so I wanted to see what was causing the chest pain.
Any coughing or anything associated with the chest pains?
No, just...
So like no allergy or anything related to that?
No, not at all.
Okay,
Just...
let me go ahead and take your blood pressure and listen to you, and we'll go from there. Any history in your family of high blood pressure or high cholesterol, anything like that?
Yes, actually, my mom's side of the family.
On your mom's side?
Yes.
Okay. And are you currently doing anything like low-fat diet or anything like that?
No, not at all.
Okay. Well, that's okay. We'll figure out what's going on. Your blood pressure is a little high. Are you stressed out at all today?
Well, usually with school, just, with the test, and I have to study, so...
Okay, but nothing any more than normal?
No.
Okay. Sometimes when people come to the doctor, it makes them a little stressed and nervous, so I tend to always ask that first. Okay, let me listen to you. Take some deep breaths for me. One more time. And just one more. Well, you sound okay. I'm concerned because you're so young. And then the family history. Would you be opposed to doing some blood work?
No.
Okay, well, I want to get some blood work back, and let's see if maybe that can give us any kind of indications. Okay, so follow me to the lab and we'll get that taken care of. Looks like we have the blood results back. It looks like you don't have necessarily a problem with your cholesterol. It just seems like it's high blood pressure. What I want us to do is to implement a diet where you don't have, you don't stop at McDonald's. Instead of maybe stopping 3 times a week, maybe just stop 1 time, and let's cut back the fatty foods on that and see if that'll bring it down. Before we go in and do any kind of medication, because we always want to do holistic stuff first before we get into heavy medications. There is a medication called Lipitor, and it will reduce your blood pressure. The only side effects, and the only reason I don't want to start that way first, is because it's not so high that we need to worry about stroke or heart attack or anything like that. We're catching it on the early stages. So if we can, the longer we can keep you off medication is what we want to do.
Okay, is that what's causing the chest pain then?
Right. Anytime you have high blood pressure, what it is you have your blood vessel, and when you have high blood pressure, it makes the blood hit against the walls, which makes the blood vessels expand. So anytime, and especially if you're exerting energy, say like just walk into the mailbox or something, it starts making your heart pump faster, excuse me, than if you were sitting down. So your heart's automatically going to start working, which is going to make you have that heavy feeling. Where if we can control and get the blood pressure down, then the blood's got more room to flow and it's not hitting as hard. Does that make any sense?
Yes.
Okay, so we're good with the diet and stuff.
So what kind of food can I eat?
And basically what I tell my patients is, instead of, it's not you have to change your whole diet. It's just changing certain aspects. So like I'm a person who loves fried chicken. Well, what I do is, instead of eating fried chicken 3 times a week, I do maybe on Monday I'll do a grilled chicken breast, and then Wednesday, go ahead and have your, Popeyes. And then, Friday, maybe instead of having French fries, maybe do baked fries. So it's just the little things in your diet that you can switch up. Or if, I use another example, the Promised Land whole fatty, whole D milk. If you're used to drinking that, maybe switch down to 2%. That's not going to be a major difference in taste, but it's going to be a major difference in how, you know, the cholesterol and everything plays into your blood pressure. Okay.
Yeah, because it's going to be a little bit hard because I work and go to school, so I just, you know, stop by McDonald's and get me something to eat right quick and then go home and sleep.
Well, you may too, and especially with McDonald's being our staple, maybe switch. They do now have a grilled chicken strip. So instead of eating maybe chicken nuggets, get the grilled chicken strip and see how you like it. And another thing you can do too is, even if sometimes the grilled doesn't have, you know, the flavor that we want, pair it with a sauce. Because when you're pairing it with a sauce, you're still getting the flavor, but you're not getting all of the bad stuff that goes with it. Okay. Also, when you do that, you'll see the diet almost has an immediate effect in the way that you feel. So you're going to automatically start not having that tightness, that heaviness, that pressure right here. And your headaches won't be there, and any, you know, blurry vision or anything. That'll start to go away. So you're going to see immediate improvement as opposed to the medication that takes a couple of weeks to go into effect.
Do I have to exercise or do anything?
I say start off slow, because we don't, if you're not used to exercising, we don't want to put you out there and have you run a marathon and you fall over and go, oh my gosh. So what I say to my patient is walking, because walking is making your circulatory system move, as opposed to maybe getting just where you're doing just, you know, your legs, or, you know, you're just slowly. Water aerobics is good too, where you're not having the pressure of the outside on you. Okay. Do you have any other questions for me?
No, that's it. I guess I'll start with the diet, and do I have to do a follow-up, or?
I want to see you back in about a month. I want to see how the diet's working. If you have any concerns, or if your symptom gets worse, or if there's anything that's immediate, call my office immediately. We'll get you back in, or we'll have you go to the hospital, because this is something, it's not life-threatening now, but we need to watch it going forward, okay?
Okay.
Okay?
No problem.
Well, thank you so much for coming in.